Good morning, good afternoon, and good evening, everyone. Thanks so much for joining me. This is my first LinkedIn Live, and thanks for joining me. Returning to work safely is an important topic. I'll provide an overview of some considerations and then take your questions. I'll do my best to answer as many questions as I can, but we may not have time for me to get to all of them. There are certain structured steps to returning to work safely. And let me make one point at the outset. Public health is not getting in the way of economic recovery. Public health is the route to economic recovery. And one of those important features is helping us restart our work in our workplaces without rekindling spread of COVID. The first thing you have to do is a risk assessment. That's important to conduct before you make a plan. That way you can safely open your workplace and determine what needs to change. For example, an open plan office is going to be much more difficult and require much more adaptation than a workplace with all private offices. Designate a COVID-19 coordinator to ensure clear lines of communication and a focal point to receive feedback. Paid sick leave is fundamentally important. Without it, people have an incentive to come to work when they're sick. That endangers staff, customers, clients, everybody. Barriers to using paid sick leave, like requiring a doctor's note, should be discouraged. So paid sick leave is the first key point to think of. And you need to think about it not just for your employees, but for anyone who comes into your premises. That includes people who clean, contractors, and others. The second key concept I'd like to go through after this first of risk assessment is the concept of a hierarchy of controls. And you can see the slide now. This is really important. We tend to think either that there's one thing we need to do or a bunch of things we need to do, but actually there's a hierarchy of what's more important. This hierarchy of controls can guide employers to introduce measures that make the most difference. Now, the hazard of COVID-19 can't be removed by an individual workplace. That can only be done by society and public health boxing the virus in. But each business can take steps along the other levels to reduce the risk. Engineering controls. Engineering controls are meant to isolate people from the hazard. They don't require individual behavior change or extra effort from employees. Examples of this are changing seating plans to ensure physical distancing, changing soap dispensers so that they're touch-free, using physical shields and barriers, for example, plexiglass dividers, using signs, tape, and markers to remind workers about appropriate physical distancing, removing communal equipment such as coffee machines and water coolers, improving the use of ventilation systems so that there's more outdoor air, more circulation, more airflow, and in some situations, opening windows to dilute the indoor air and improve the airflow. Next is administrative controls. Examples of that are staggering shift hours for your employees, supporting virtual communication and meetings, allowing for continued work from home policies when feasible. And one very important feature of this is really what we would call the accommodating or reasonable accommodation for people who have underlying health problems or who are older. They're going to need to be safer. And that may mean that they're allowed to telework for longer, or that there's a change in what their duties are so they're less likely to come into contact with many members of the public. Or they may need to be given sick leave because they can't safely come to work if there's widespread dissemination and transmission of the COVID virus during a particular period of time. In addition, adapt cleaning and disinfection practices, and you have to be very specific about this. You can't just say clean regularly. There has to be a protocol, someone has to be responsible for doing it, and it has to be monitored to see if it's being done. Promoting additional hand hygiene, such as touch-free sanitizer dispensers at entrances, and for some workplaces, mandatory. You walk in the door, you must use that. Encourage face mask use when appropriate. Provide training on personal practices to minimize or reduce risk. Also, minimize non-essential work travel and support safer means of commuting to and from the office, including walking and cycling. screening employees through a series of questions or temperature checks, particularly in places with high levels of community transmission, and testing. Testing is a much more complicated consideration. Testing for active infection among persons who don't have symptoms is not currently recommended by the CDC for workplace safety. It is important for some other situations: nursing homes, jails, prisons, homeless shelters, places that are congregate locations. Particularly if they have cases of COVID, everyone should get tested. But as a general return to work principle, testing is something of a false promise. You're not going to test every day, and people can be negative today and infectious tomorrow. Now, this is different for high-risk work environments like healthcare centers, which need a much more stringent level of control. Controls need to be decided on a case-by-case basis. It's not a blanket requirement. Now, testing for antibodies is really popular. Everyone's talking about it. As of today, June 12th, 2020, it has absolutely no role in workplace practices. That may well change in the future as we understand more about COVID-19, as we understand more about immunity and about the tests and the different types of tests. It's not too soon to think about and plan for use of antibody tests, but it's definitely too soon to use them for any decisions in the workplace. Another feature that you have to plan for is dealing with a worker who becomes sick. There have to be protocols in place that include a chain of notification, prompt isolation, and a procedure to connect people to care. For those who become sick while away from the office, they also need guidelines for notifying their supervisor. These will require paid sick leave and established guidelines for returning to work. It's very important to think about where we're going to provide for paid sick leave. Someone who's sick, someone who's caring for someone who's sick, and someone who's exposed, and potentially someone who just has such severe underlying conditions that they can't come in and can't do their work from afar. Vulnerable populations may need different precautions, reasonable accommodations for people with pre-existing illnesses, disorders, or disabilities. Basically, planning is important. During a pandemic, when risk levels and information on the virus continue to evolve, a multi-tiered approach to workplace safety is absolutely necessary. Additional information, guidance, and I think a very helpful brochure or booklet and checklist is on our website at preventepidemics.org. Now, I'll be happy to answer some of your questions or do my best to answer them as effectively as I can. So I'll turn it over and we'll look at the chat and see how we're doing with questions. So here's the first question that I often get. I talked a bit about the importance of comprehensive policies, but not in so much detail about antibody tests. And antibody tests are the area where there's the most question. What we hope, what people wish is, could we just get an antibody test, and then if it's positive, or if you had confirmed COVID in the past, whether or not you had an antibody test, can we think that you're safe? Do you get essentially an immunity passport? And the answer is, we don't know. We don't know whether prior infection protects you against a future infection. We don't know if it does, to what extent it does. We don't know if it does very well, how long that protection will last. And that's why I say that as of today, antibody tests really have no role in the workplace. They might in the future. Emerging evidence suggests that at least some people infected are immune for some period of time, but we don't know that for sure. We don't know who, we don't know for how long. Here's one question. How effective is weekly or bi-weekly testing of asymptomatic staff working in high-risk settings, such as hospitals or nursing homes? Some states have mandated that nursing home staff get tested twice a week. This is a sensible approach because nursing homes, as I said way back at the beginning of March, are ground zero for the COVID pandemic in the United States. The risk is that we will have hundreds of thousands of deaths in nursing homes. There are as many as 1.5 million people living in nursing homes in the US. In nursing homes that have had large outbreaks, there's been as high as a 20% mortality rate among all of the residents of the nursing home. That means, in theory, there could be as many as 300,000 deaths just among nursing home residents in the US. Already there have been about 30,000, maybe even 40,000 deaths in the US in nursing homes. But there have also been controlled outbreaks. To control outbreaks in nursing homes, we have to do three things: keep the virus out, find it fast, and stop it soon. We keep it out by limiting visitors, by having everyone wear a mask, and by testing healthcare workers. Now, testing is one policy. Another policy is, what do those healthcare workers do? If they're working in many different healthcare facilities, they're at increased risk. We have to make our healthcare facilities safer. But that's an example of how asymptomatic testing may have a role in certain circumstances if there is enough testing resources in a community. Next question is, when would it be safe to start traveling nationally or internationally again by plane? And is it safe now? Tough question. The flight itself is of not enormous risk, but getting to the airport, getting through the airport, getting to where you're going, staying in a hotel, all of those things do involve some level of risk. You need to know what the risk is in the community that you're living in and what the risk is in the community that you're going to. You may be faced with quarantine when you get to certain places, or you may be going from a place that's got a very low rate of infection, like Hawaii or Alaska in the US, which currently have very few infections, going to a place that have a lot of infections. And when you come back home, you may be subject to quarantine. So you have to understand what those risks are going to be. We can't predict when it will be safer, but we can tell businesses that the single most important way you can protect your workers is by making sure that your communities are doing public health well, that people are doing the 3 W's: wear a mask, wash your hands or use sanitizer, and watch your distance, and that your public health departments are boxing the virus in with testing, isolation, contact tracing, and quarantine. Those 4 corners of the box that keep the virus in a smaller and smaller space that give us a bigger and bigger space to come out to in society. We either have to shut down the virus with public health, test, trace, isolate, or we may have to shut down our economy again. Next question comes from Mohammed Zahir. What are your suggestions for developing or lower income countries that want to reopen but have limited resources to make changes to existing infrastructure? Another great question. What we see in places in Africa, Asia, the Middle East are a couple of big differences from the US and Western Europe. One, the age structure of the population. Many fewer people above the age of 60, and many fewer people with chronic health problems, or lower proportion. Also, a larger competing mortality. In Africa, we're very concerned that reduction in healthcare services because of fear of COVID could actually result in more deaths than COVID results in. There could be millions of deaths from measles, malaria, tuberculosis, and other conditions in these countries if healthcare slows down. So I think in communities that have limited resources, we've seen some really encouraging work to do the good public health work of test, trace, and isolate so you can limit the spread of the virus. Use of face coverings, surgical masks, or cloth face coverings, which do reduce the risk that it will be spread. Some things that don't take work. If you can take it outside, take it outside. If you can do distance work, do distance work. But each community is going to have to adapt to this new normal of a world where COVID is spreading. And it's not going to be easy. But this isn't a question of health versus economics. This is a question of how public health can help economic recovery. The next question is from Jim Trask. How reliable are the current antibody tests? Unfortunately, not very reliable. To be blunt about it, the Food and Drug Administration of the United States has not yet found the Goldilocks point. It was far too slow to let hospitals and commercial laboratories develop PCR or antigen tests to detect the virus that causes COVID, and far too quick to approve a whole bunch of very low quality tests of antibodies. Over the next few weeks, we hope an additional, many more antibody tests will be taken off the market. Many have been taken off already, so that we'll have more reliable test results. The problem is, fundamentally, we still won't know what they mean. A positive test means, if it's done well, that yes, you've been exposed to this virus, but does it mean that you're immune? We don't know that yet. So stay tuned as we learn more. And one of the things that we can learn more by doing are very careful epidemiologic studies. This isn't just a question of figuring it out in the laboratory or looking at the molecules. This is about doing the epidemiology, the hardcore work to see, are people getting infected when they have prior antibodies. This is really rigorous epidemiologic studies, and this is the kind of thing that we need our public health agencies focusing on now. The next question is from Eli Graves. For offices specifically, along with reducing capacity, spacing seating by closing certain areas, and staggering schedules, there are some more serious measures being considered. What are your thoughts on wearing masks in the office, plexiglass dividers, and one-way corridors? Well, let me start with one-way corridors. I think that's a great idea. I just saw it in the last couple of days. It's in our guide. And in our own offices at Vital Strategies, where Resolve to Save Lives has our initiative, it's an open plan space. And so you frequently will pass someone in corridors. By having simple tape markings on the floor of one way, you make it more efficient to walk around, and you reduce the chance that you're walking face to face with someone else. If you are indoors within 6 feet of someone else, you need to wear a mask. If you are in a community that has widespread transmission of COVID, you need to wear a mask. If you're outdoors and you're within 6 feet of someone for a prolonged period of time, you need to wear a mask. Masks are a much less disruptive intervention than shutting down workplaces and economies. In Asia, for many years, it's been standard for people who feel sick to wear a mask. And actually, that's probably tamping down their level of influenza. If we wear masks, wash our hands, and watch our distance this fall and winter, we're going to have a lot less flu. So there are lots of benefits to wearing a mask. Plexiglass dividers may be needed, particularly in places where you just can't get that 6 feet of distance. And some places may want to install them anyway to reduce the risk that a sneeze from somebody who's not wearing a mask, and maybe more than 6 feet away, but sneezes can spread viruses quite a ways, may be useful. So that's something that has to be made a particular plan for the different workplaces. Next question is from Shaher Mahbub. Should a contact tracing app be made mandatory for office workers? I could talk for an hour about this question. It's a really important one. So if there is an exposure in the workplace, there needs to be a plan for how that's going to be dealt with. There are different types of digital tools or apps being explored to improve contact tracing. Some of those we're working on at Resolve to Save Lives, and will release open source for anyone to use. They may help people identify who their contacts are. They may help people who are on isolation report in their status and get services that they could benefit from. They may help contact tracers to find people who need to be warned that they're either spreading the infection or exposed to it. The other type of app is called a proximity tracing app, and this is the app that Google and Apple have collaborated on. I'm very skeptical about the utility of these apps. They're unproven, they may be infeasible, and they scare people. So I think proximity tracing apps have been a big distraction. COVID is a public health crisis. Public health is going to be able to show us the way forward, guide us, and needs our support. When people started hearing about contact tracing, I heard two things that were just wrong. First was, anyone can do that. And the second was, that can be replaced with an app. I think there's now widespread recognition that human-to-human contact is essential for contact tracing. But there may be some digital tools that are helpful. In some countries, for example, people are recording digitally places they've been. In some workplaces, there has been an idea. Could an app be mandated for every person in the workplace? So if there is an exposure, it's known who they might have exposed. The problem is that's not going to extend out of the workplace. You're not going to have a closed system. And we don't really know the accuracy of those systems. Does it have the ability, even with Bluetooth, which is better than GPS, to tell you that someone has been in contact for more than 10 or 15 minutes within 6 feet? So by all means, we should explore and study that kind of app, but right now it's unproven. Now, that's all for questions for today. I hope you've enjoyed this LinkedIn Live. It's my first. Tell me how you like it. Follow me on Twitter and LinkedIn, and I welcome your suggestions for what would be interesting to cover in the future and whether it's worth doing another one of these. Thanks so much and have a great day.